Well, welcome back. Ahead of the governor's budget revise this Thursday, healthcare advocates continue to push back on the hundreds of millions in proposed cuts to healthcare programs.
This comes amid the state budget deficit and federal funding cuts. ABC 10 State Matters political reporter Jenny Huff joins us now with the latest. Jenny.
Well, May revises when the governor amends his January budget based on internal and external feedback, while the most up-to-date details on how much will go to healthcare programs remain to be seen. There's a strong push for more, not less investment.
This is not cutting costs. This is costing lives, and California must respond with the courage for health for our constituents.
We are all sick and tired of being sick and tired.
Tuesday morning, continued calls by the state legislature to oppose proposed cuts to healthcare programs in Governor Gavin Newsom's budget.
Between a different kind of budget environment plus the cuts from H.R. 1, we're now in an environment where our legislators are looking to cut more than expand.
When you look at the cuts that are being proposed in the governor's budget, those cuts are unacceptable.
The California Department of Finance tells us the state is absorbing about $1.4 billion in administrative costs from new eligibility requirements for healthcare and food assistance programs under H.R. 1, the so-called Big Beautiful Bill. Of that, $1.1 billion in additional costs are for Medi-Cal, but healthcare advocates argue Newsom's budget proposes state-level cuts on top of the federal cuts, threatening
medications, durable medical equipment, specialists, behavioral health care, in-home supports, and wraparound services.
The nonpartisan legislative analyst's office says Newsom proposes ending comprehensive coverage for refugees and certain other non-citizens, and extending the new eligibility requirements under H.R. 1 to additional immigrant groups with state-only funded comprehensive coverage, a population not bound to the new federal rules.
Because heartbreakingly, California's proposed budget is set to go even further. That is a choice. That is a choice that California is making.
These proposals, the LAO says, would save the state around $900 million in 2026 to 2027, with savings of up to a few $1 billion annually in the future. There's also pushback on proposed cuts to in-home supportive services programs known as IHSS, about $323 million slated to be cut in the budget.
We can't balance the budget on the backs of vulnerable residents.
Mr. Governor, what that means is that we're just waiting on you.
And as first reported by Politico and confirmed to me by Newsom's Department of Finance, Newsom's revised budget will include $300 million for Covered California, the state's insurance marketplace. Chris, Laura.